I cannot emphasize enough the importance of the caregiving role, right? From my own personal experiences, I would not be alive or I would not be talking to you today if not for Nilima, right? That's how important the caregiver's role is. And just like I was thrust into the cancer patient role when I was just 40 years of age, she was thrust into the caregiver's role when she was only 35 years of age, right? And so almost 100% of caregivers are thrown into the deep end of the pool with no warning, no training, no preparation, nobody to show you the way, and you are left to fend for yourself, and you are left to look after your loved one, right? So if you think about it, that for most human beings, you would rather suffer than to see a loved one suffer, right? This is how we are conditioned. So imagine the role of a caregiver where they not only have to help the person, but they have to see the person suffer. And in cancer, very often, more than 50% of the times, that person is going to die within a few years. So it's a very, very difficult situation. So what we say to caregivers before giving any advice is, first of all, I just want to honor and salute all the caregivers because they make it possible for that love and care and support and healing to be made available to the person who needs it when they most need it, right? So I want to start with that. The second thing that I want to say is that, just like Nilima has done a wonderful video on tips for caregivers. It's available on our YouTube channel. Maybe you can put up the link and people can go and see it later. But one of the things that she talks about is that, the message that you see on the aircraft, which is wear your oxygen mask first before helping anybody else, right? So if you use the same analogy or metaphor and say, are you wearing your own oxygen mask first? Are you looking after yourself first before you are looking after somebody else? I think that's a very important thing that caregivers often neglect because they are so concerned and they're willing to sacrifice themselves. But frankly, you're no good to your loved one if you're not strong enough yourself. So caregivers also need to look at the physical, the emotional, the mental, the relational, and the spiritual for themselves first before they can, or alongside helping their loved one. So that's one thing that I would say. The second thing that I would say, again, based on our own experience, personally and professionally, is that caregivers must know where to draw the line. And that's not easy to figure out because every family situation is different. Every illness situation is different. Every patient's condition is different. And at different stages in the patient's journey, the caregiver role also evolves. But at each stage in that journey, the caregiver must know where to draw the line and where to say no. Otherwise, you can also be sucked into the whirlpool of the patient and their declining health and so on and so on and so on. So remember that the healing responsibility is the patient's. You cannot heal on their behalf. You can support them in the process, right? So that means you have to know where to draw the line, where to say yes and where to say no. This is the second tip I would give to caregivers. The third tip I would give to caregivers is don't try to do it alone. Ask for help. Again, we have a tendency to say, this is my sacrifice for my loved one, and to treat it like I'm the only person who has to do it. But no, there's plenty of help available. There are therapists, there are workshops, there are books, there are, support systems, there are support groups, all kinds of things are available. But if you don't go out and look actively, you won't find them. On the other hand, in some cases, caregivers are given too many inputs from lots of well-meaning well-wishers. आप ये खाओ, आप वो पियो, आप ये काढ़ा बनाओ, आप हनुमान चालीसा करो, आप इसको जाके मिलो, उसको जाके मिलो, all this kind of stuff. And now this creates a hell of a lot of confusion. So who are you going to get get the right advice at the right time? This requires the caregiver to be quite discerning, but also open to help. Right. And the last thing I would say to caregivers is that just like cancer or a chronic illness is an opportunity of growth for the patient, your caregiving role is an opportunity of growth for you. So if you see it not as a sacrifice, or if you see it not as a chore, or not as a drudgery, or not as a punishment, but you see it as an opportunity for growth, then hopefully not only will you be able to care for your patient, for your loved one, but you will also grow in the process. So these would be some of my tips to the caregivers, irrespective of what kind of illness is it. And even if there is no illness, even if you're caring for the very elderly, I believe that these principles will still apply.